Hi, this is Lynn Murphy, and I am going to be doing the assessment for Module 5 for my patient Lisa. This is the abdominal assessment, and the first thing I'm going to do is I'm going to come into the room, make sure that she's already voided to make sure she has an empty bladder for the exam. Put a pillow under her head, raise the head of the exam table to about 35 degrees, and make sure that her knees are bent for comfort as well. I want to make sure that her abdominal muscles are as relaxed as possible. I'm then going to visualize her abdomen. I'm going to look for any scars, any bruising, any umbilical hernia, which I don't see any of those. I'm going to look for peristaltic movements. I don't see anything. Everything looks normal. I don't see any pulsations in her abdomen either. So the next thing I'm going to do is auscultate for vowel sounds. I'm going to check in all 4 quadrants. And when I do the visual assessment, I'm going to make sure I have my light on. Turn that off now. I'm going to auscultate all 4 quadrants. And I hear normal vowel sounds. The next thing I'm going to be doing is checking and listening for bruits, where I'm going to listen to a couple of our arteries. I'm going to do the aortic, bilateral renal, iliac, and then femoral. Check the aortic here. And then the renal over here, but I would do it bilaterally. Sounds normal. I would do the iliac, and then I would check the femoral. Good. Everything sounds completely normal. The next thing I'm going to do is percuss her abdomen just to see how everything sounds. Everything sounds good. I hear her whole abdomen. It gives me tympanic sounds. If you did hear some dullness in the lower abdomen, it might just indicate that there would be stool in there, but it sounds excellent. The next thing I'm going to do is percuss the liver, and I'm going to mark off an area so that I can measure and see what the length is. So I'm going to start off up here. First dullness that I hear, I'm going to put a piece of tape about there, and then I'm going to start in the lower area and do the same. And I'm going to put a piece of tape there, and then I'm going to measure that area. And it should be anywhere between 6 and 12 centimeters. And it is 8.5. So that is perfect. Next thing I'm going to do is lightly palpate her abdomen, see if I can feel any abnormalities, any lumps. I'm also going to watch and see if she grimaces at all or verbalizes any discomfort. Make sure that this is all nice and soft, there's no firmness. It feels good. Next thing I'm going to do is just deeply palpate a little bit harder. You having any pain? Excellent. Next thing I'm going to do is just palpate under here, see if I can feel her liver. I'm going to have you take a nice deep breath. And I cannot palpate the liver, so that is good. I'm going to have you just roll a smidge over here. I'm going to feel for the spleen. I do not feel anything, so the spleen is also not palatable, which is good. I'm going to have you sit up if you don't mind. And now I'm just gonna check her for CVA tenderness. Do this side so you can see. No discomfort, Lisa? All right, it looks good. Excellent exam.